Black mothers across the country are facing a health crisis, whether it's COVID-19, diabetes, or just being heard. Vice President Kamala Harris has said it's due to institutional racism and implicit bias, and she's trying to do something about it. Now, a familiar face is teaming up with a healthcare company to try and do something about it as well. We want to welcome to the show Dr. Jackie Walters, an OBGYN in Atlanta, and co-star Bravo's hit Married to Medicine, and Kim Keck, the president and CEO of the Blue Cross Blue Shield Association. Ladies, good morning. Thanks for being a part of BNC this morning.
Good morning. Good morning. Thank you for having us.
Good morning. Oh, of course. This is a major issue, Dr. Jackie. Of course, we see you give your patients extra care and attention on the show. But what disparities have you seen or heard about through your years in the medical field, especially when it comes to Black women?
Well, obviously, we're tackling maternal death, where we're seeing African-American women die 3 to 4 times more. And we're working to understand and figure out what is it we can do to make a difference.
Yeah, why is that, Kim? Why do you think that's the case? As you mentioned, women are 3 times more likely than whites to die from pregnancy complications than whites. What's the reason for this?
You know, it's not one-dimensional, Mike. Just like this problem is not one-dimensional, there's not a one-dimensional solution. But I would say more simplistically, this is a crisis. We have a crisis in racial disparities in healthcare in this country, and it's simply unacceptable. It's unconscionable, really. So we're excited in many ways to begin to put an end to racial disparities in healthcare and really build a new model of equitable health and health caring. And there are many reasons. I'm happy to elaborate, but it's a broad strategy, and we're really excited to begin to start this work.
Yeah, absolutely. Even more telling is that 2 out of every 3 of those deaths are preventable from Black women in pregnancy. So what are you doing about it, Kim? You and Blue Cross Blue Shield, you have a new program. Can you tell us more about it?
Yeah, there's a lot of things we're doing about it. And I would say a couple of things. We are really amplifying programs that are already underway, but we're also building we're also building new solutions. First and foremost, we're setting a bold goal for ourselves, and we're holding ourselves accountable. So we're focused right now on maternal health, and in particular on maternal health. We're committed to reduce maternal disparities in health by 50% in 5 years. And as I said a moment ago, there are programs already underway, and some of those are things that are pretty basic and really critical. So, for example, building issues that stem from unconscious bias, we're building training. We have one program in Michigan at Blue Cross Blue Shield of Michigan that is training 20,000 physicians on unconscious bias training. So if you just think about that one program, Blue Cross Blue Shield companies across the country have provider relationships, contracts, if you will, with 1.7 million providers. So imagine if we could even address 10% of those providers and do implicit or unconscious bias training, the reach we could have. But that's just one example.
Dr. Jackie, I'm always hearing a lot of Black physicians saying, you know what, we in the medical community, we have to admit that we've made errors in the past, and we have to do something about it. Why was it so important for you to get involved in this?
Mike, I don't think I couldn't get involved because obviously being a woman, being a Black woman, and being a Black woman who's a doctor, I think we have to better understand what the problems are so that we can attack the problems. And obviously as a physician, I'm on the front line, so I get to see it front line. I do think it's 3 parts, and I'm so honored to be partnering with Kim because I think we have to educate the patients better. Certainly as a physician, as a provider, we have to educate us more. And now that we have the insurers with their awareness, I think we're winning.
Yeah, I'm glad we have somebody representing an insurance company on here because is it more of a racial issue, or is it more of a wealth issue? With a lot of some people just don't have the medical insurance, and when they don't have the medical insurance, sometimes they're not treated the same when they go into a doctor's office or at a hospital. Kim, can you speak on that?
Absolutely. And look, we're thrilled to have Dr. Jackie join this effort as well, because having the physicians and the patient's voice alongside of us is so important. But it's way broader than that, too, in terms of these underlying root cause issues, if you will. Mike, I would say we started this work, Blue Cross Blue Shield companies, a year ago, June of 2020, almost a year ago. At a time where we said we want to make meaningful change to address systemic racism and injustice in our communities. And so we'll start by addressing health disparities. But these programs that we have underway are not just about covering and giving access to everyone, including people and communities of color. That is certainly part of it. But this is addressing some of the root causes that get at maternal health, that get at these disparities. So things like even prenatal nutrition, visiting pregnant women in their homes before their pregnancy, visiting them in their homes after even their child is born for up to 2 years in one program that we have at Care First, which is a program, Be More for Healthy Babies, which has reduced, I think it's something like by 30% infant mortality in that city of Baltimore. So these are systemic issues that go just beyond access, but certainly access to affordable care, safe care is part of the solution, absolutely. But it's also advocating for broader solutions. I just would say one other thing, because not just locally, but even nationally, we're working with a panel of national experts to get their counsel and expertise, but also at the federal level, advocating for positions and legislation like the Momnibus package that's in front of Congress right now.
Yeah, I like what you said before, because I think that's important for people to understand. It's not just about the actual childbirth, it's about the prenatal care and then also postpartum, Dr. Jackie, which is still so very vital and so very important to be recognized when it comes to women, the aftercare when a woman has a child.
Absolutely. And, you know, we put a lot of things in place now where we used to see moms 6 weeks postpartum. We're actually bringing them back earlier so we can recognize if there are problems. We put some things in place in my office actually to reach out to make sure mom is okay, make sure she's connected with a pediatrician even before the delivery. So we're all addressing and are aware that there are things that we need to correct, and the work is started.
Before I let you go, I have to ask you this, because sometimes you can go in there and you can have insurance, or you might not have insurance, but you go into a doctor's office and you might be treated a little bit differently, especially as a person of color. Just being honest here. How can a person of color, a black woman especially, be heard? You're telling the doctor that you have an issue, and sometimes they just misdiagnose, so they send you home. They think you got a higher pain tolerance. How can a black woman ensure they're not only heard, but something is being done about it?
And that's a great question. I think, as we said, and as I keep saying, we have to educate all three parties. One, I'm really working very hard with the patients to make sure they articulate exactly what they mean, because as a physician, we're confused sometimes by the message. So we're educating the moms, we're educating the providers, and now that we have the insurance companies working with us, I think we're definitely going to get ahead. So education is going to be the key.
Yep. All right. Well, Vice President Harris is making this one of her main priorities and said it's an urgent need. We'll see what happens in the future. We appreciate your time. We appreciate your efforts. Dr. Jackie Walters, award-winning OBGYN and co-star of Bravo TV's Married to Medicine, also on Real Housewives of Atlanta sometimes. And Kim Keck, President and CEO of the Blue Cross Blue Shield Association. You see, Dr. Jackie had to throw that in there, of course. Good to have you in the family. Thank you for starting your day with us.
I see you.
We will see you.
Thank you.
Appreciate you.